Alzheimer's tonight, and as you know, my goal is to, the reason I do these talks, and I'm surprised more people aren't here. Do you think Alzheimer's is a problem? Is it an issue in our culture?
Yeah.
I mean, pretty much everybody agrees. You know, this is my neurology textbook from chiropractic schools back in 1978, 79. And they don't have anything on autism. Autism is not even mentioned in this book. They have a little paragraph or a couple little paragraphs on Alzheimer's, but not very much, okay? Just this description. They knew about the tangles in the brain back then. But back in then, nobody really ever heard of Alzheimer's outside of, you know, medical specialties. There was never any discussion about it in our culture. Did anybody in here have parents who lived to a decent age and had their faculties when they died? Yeah.
My dad was 96.
Yeah, 96. My mother's 93. She's fine. She drives me to the grocery store when I'm out in California. You know, she cooks. You know, she cleans. She watches Fox News voraciously. You know, she reads. You know, and so both my sets of my grandparents died in their 90s, and they had all of their faculties at the time. And so Alzheimer's it's really a disease of modern society, really. And my goal in presenting this talk and really all my talks is I just want to make people in Lincoln more aware of what's going on with their bodies and how to take care of them. So, I mean, I would bet nobody in here wants Alzheimer's. A really dumb question, right? So the goal is let's give people information so they can keep themselves healthy, so they don't have to have this stuff when they're older. I mean, and I don't think we should have to have it. And yet, you're going to find out Alzheimer's is one of the fastest growing diseases in our culture. So let's go ahead and get into it. If we look at, this is a Canadian Journal of Psychiatry in 2013. 1 in 3 seniors, U.S. seniors, dies with Alzheimer's disease or dementia. 1 in 3. Back in 1978, nobody'd heard of it in the 70s. Nobody had heard of the word Alzheimer's. But now, 1 in 3 dies with it. Now, do you think that means that we have some issues in our culture with things that are causing our bodies to break down?
Yes.
Or do you think it's just a failure of diagnosis?
No. It's our lifestyle, our foods.
Yeah. I mean, if it's a failure of diagnosis, then the medical profession would have to say, yeah, we've been lousy diagnosticians all these years. They're not going to say that. It's not a failure in diagnosis. It's, you know, according to some places that I read, not everybody is saying this. It's the third leading cause of death in the United States. This is a true statement, though. The Alzheimer's disease crisis could bankrupt the U.S. by 2050 as a cost for caring for those with Alzheimer's disease is skyrocketing. Now, I'm going to talk about a test later on in this talk. It's like $720, and it can give you, I'm not trying to advertise it, saying you should have it, but it will tell you if you're heading in that direction or what's going on with your brain. Now, when you consider that, the cost of that test versus the cost of caring somebody for Alzheimer's, what do you think is cheaper? Getting the test, you know, and fixing your brain if it's not working. So of over 240 experimental drugs intended to cure Alzheimer's have failed in the past 30 years. On January 8th, 2018, Pfizer put out a press release that it halted research into Alzheimer's and Parkinson's because none of the stuff they were doing was working. Now, I'm going to tell you something really interesting. Maybe some of you know this, maybe you don't. You know, Vivek Ramaswamy, who's running for president, probably one of the most brilliant human beings I've ever seen. He graduated from Harvard with a degree in biology and started his own biotech company afterwards. And he ended up, later on, he bought an orphan Alzheimer's drug from Pfizer for $5 million. Orphan drug meaning, Pfizer had tried it, they couldn't really do anything with it, so he thought, well, we're going to see if we can. They bought it for $5 million. You got a bunch of people interested in investing in that product. And guess what? Failed. All the investors lost their money. So it's not something there isn't a drug to fix it. There just isn't. And so we have to get this idea out of our head. Anytime we have a disease or a symptom, some pharmaceutical company is going to come along with this wonderful thing that we just take and everything is better. Just isn't happening like that. So if we look at the brain comprises 2% of the body's weight, yet it uses 25% of the body's cholesterol. 25% of your cholesterol is in your brain, okay? By the way, anybody know where the rest of your cholesterol is? Anybody have any idea?
Liver?
Liver, a great answer. Yeah, a lot of it. Liver, cell membranes, adrenal glands, cholesterol plays an important role in shaping the brain's circuitry. That's why we need cholesterol. That's why the liver, if you're not getting enough cholesterol in your diet, your liver makes up for it and this is one of the reasons, not the only reason. Alzheimer's may be a consequence of the inability of neurons to function properly due to a deficiency in fats and cholesterol. That's Stephanie Seneff. She's a PhD researcher at MIT, and she does a lot of research on this kind of thing. A lot of nutritional research, a lot of research on vaccines and things like that. She's done a lot of research on glyphosate and its effects on the body. There's a lot of people that don't like her, by the way. A lot of people that would like to see her gone.
She tells the truth.
Yeah, she is. She's telling the truth.
Pharmaceutical companies.
The amyloid beta plaques that are found in the brains of Alzheimer's patients, they're essentially found a defense mechanism by the body to compensate for low nutrient status, toxicity, hyperglycemia, inflammation, and the many other issues that can affect the brain. So here's an interesting thing. Pharmaceutical companies were able to make drugs that successfully got rid of these in the brain. What do you think happened?
People got Alzheimer's.
Made them worse. Because this is a defense mechanism. This is the body putting up a defense mechanism that for something else that's going on in the body. So you get rid of the way the body defends itself. They got worse. They didn't get better. The drug worked great. Just like cholesterol drugs work really well, lowers cholesterol really well. The problem is our body needs cholesterol for all sorts of things. So people have problems when their cholesterol is too low for too long a period of time. So what exactly causes Alzheimer's? We're going to be looking at a lot of the causes tonight. Blood supply of the brain, one. Diet, excess sugar and fat. Toxicity, nutrient deficiencies, infections, and hormone imbalances. So let me ask you a question. Do you think that our brain needs nutrition to function right? Of course it does, yeah. I mean, for us, we think, that's pretty obvious. But there's a lot of people out there that I don't think get that. Science is showing that the underlying processes that cause Alzheimer's begin decades before the symptoms. In other words, if you look at any disease process, I don't care what it is, the symptoms are always the last stages of that disease. Always, okay? So I've heard this expression, it's just like, I have to laugh and I don't correct the people when they say it, but they say, yeah, somebody got cancer, caught cancer. You develop cancer over a long period of time due to a lot of different processes that go on in your body. And it starts a long time before you ever get symptoms, before it can even be detected. So it's the same thing with Alzheimer's. The brain circulation cause has shown that people with Alzheimer's have at least 20% less blood flow to the brain. Okay, that's in Vascular Health Risk Management 2012. Okay, so we know that intelligence is also tied to supply of blood flow to the brain. Okay, that's from a book that I have by a gynecologist by the name of Gottfried. It's called The Brain-Body Diet. A recent study demonstrated conclusively, this was in 2019, so it's not as recent anymore, loss of cervical curve causes lack of blood flow to the brain. Restoration of that curve using Adenerol immediately increased blood flow to the brain. In 9 subjects, you had a 235% improvement just by putting a patient on the Adenerol and bringing the curve back into their neck. So I constantly hound my patients about doing their neck exercises. This is one of the reasons, okay? Because blood flow when your neck is straight, your brain doesn't get the amount of blood that it does when it has a curve in it. So this would be a loss of blood flow to the brain. Right here's a reverse cervical curve. This is a normal cervical curve. And so the vertebral artery runs right along the side of the vertebra right there. So when it's like this, it's stretched and kinked. So this is Adenerol. It's a brain circulation causes primarily a biomechanical problem which necessitates a chiropractic solution. Now, according to Dale Bredesen, anybody ever hear that name? Bredesen? Okay. One of the top Alzheimer's researchers in the country. He's out at UCLA. He wrote a book called The End of Alzheimer's. Came out in 2017. Great book. He said Alzheimer's is caused by one or a combination of 3 things. Inflammation from infection, diet, or other causes. Decline in nutrients, hormones, or other brain-supporting molecules. Toxic substances such as metals, biotoxins, which would be pesticides, or molds, okay? And he has all the evidence for that in his book. Research published in 2013, and this is in the journal Neurology, which is top medical journal, showed that sugar and other carbohydrates can disrupt your brain function, even if you're not diabetic or have any signs of dementia. I know that's true. Anybody in here ever overindulged in sugar and felt your brain kind of get foggy? Mm-hmm. I have, Fortunately, I don't do that very often, but we've all probably experienced it. Or you eat a lot of sugar and you just want to go take a nap somewhere, you're going to go into hibernation. Yeah, that's what's going on here, okay? Inflammation, and as you know, is often a consequence of our diet. So high carb diets increase your risk of dementia by a whopping 89%. High insulin is intimately related to Alzheimer's. Why do the insulin test on my comprehensive blood panels? That test is so valuable. High fat diets lower it by 44%. Okay, high carb diets, Alzheimer goes up. High fat diets, it lowers it. That's in the Journal of Alzheimer's Disease 2012. So high sugar diets increase insulin, and that accelerates the inflammatory process in the body. Alzheimer's is referred to by many researchers as type 3 diabetes. Now, not all Alzheimer's is caused by too much sugar, but if you have high insulin levels and high sugar levels in your body, that's really going to increase your probability or your possibility of getting dementia and Alzheimer's. That's why getting your sugar levels normal, really, really important, okay? How do you do that, by the way? How do we get our sugar levels normal?
Exercise.
Yeah, exercise.
Eat less sugar.
Eat less sugar, yeah.
The bad sugar.
Yeah, that's right. Eat less sugar, exercise.
The bad sugars.
Yeah.
I mean,
Take nutrients that help lower blood sugar, like gymnema and chromium and zinc, nutrients like that. Sure, but exercise really, really important. Now, I won't get into what kind of exercise. I'd like to, but no, we won't do that. Let's talk about toxicity. Okay, so toxicity is another big issue. We have toxic metals that can lead to Alzheimer's. This is a big one right here, mold. Okay, mold is a big issue. A lot of people have mold toxicity, mold in their homes. They're exposed to it. I've had many patients who've gotten pretty sick from mold toxicity in their house. Now, the good news is mold in the body is fairly easy to get rid of. I mean, there's some simple protocols that will pull mold out of your body, but it can have a really devastating effect on your brain and just on your health in general.
Are those in any order, like order of severity?
No, they're just
Okay.
yeah.
Because copper, you see copper bracelets all the time. But
Yeah, and you can get too much copper in your body. We need copper. We need it in trace amounts. Copper is part of the vitamin C complex. So if you're getting like enough whole food vitamin C, you're getting copper with that. Low copper, too little copper in the diet is one of the contributors to gout. Okay, and I'd like to do a whole talk on that. But so we need copper, but we shouldn't get too much of it. Too much of it really does hurt the brain. Inflammation. We know that it can be triggered by food intolerance. This is a pretty big deal. Wheat, gluten, and grains. So somebody was asking me the other day, how do I get rid of my brain fog? What can I do to do that? So first thing you can do is if you eat these things, okay, get them out of your diet. Just to see, it's free. You don't pay anything. You don't have to do any testing. But get wheat, gluten out of your diet. Get dairy out of your diet. I would maybe reverse these, get the lectins out first. And then, but I would start with this, wheat, gluten, and dairy. Start with those two. And then go on a 21-day fast of wheat, gluten, dairy, and see if your brain fog clears up. And then if not, then look at some other foods you're eating, okay? And if that doesn't work, then maybe we should do some testing. But you can just do a little clinical trial on yourself and see if that works. So food intolerances cause leaky gut, which spills over to the brain and cause leaky brain, cause a disruption in the blood-brain barrier. So a 2017 study in the journal, I love this study, Journal of Clinical and Cellular Immunology showed that intolerances to wheat and gluten, dairy, and or plant lectins has a high affinity to cause autoimmune disease in brain tissue. High affinity. So if you're gluten intolerant, and you're eating a lot of gluten, and you don't feel like you have any symptoms, this study showed that those three things in people that were intolerant cause high rates of brain autoimmunity. That's a pretty big deal. And that's something that ought to be on the nightly news. I mean, because people are wringing their hands over Alzheimer's, and yet there's studies like this that are pretty definitive. And the guy that did the study, Aristio Vajani, one of the top immunologists in the country. I mean, he's published a lot of studies. Here's another one. This is in Frontiers of Immunology 2016. Autoimmune encephalitis occurs when the body's immune system produces antibodies that mistakenly attack portions of the brain. These autoantibodies target receptors or protein in different regions of the brain, which can result in a range of neuropsychiatric symptoms. So what do they do with people that have neuropsychiatric symptoms? What are they? What are neuropsychiatric symptoms? Severe depression, schizophrenia, things like that, okay? They put them on pharmaceuticals, but they're not looking at what may be causing the issues. And this is in the literature. Here's another one. In recent years, a number of confirmed cases of autoimmune encephalitis has been increasing annually as a growing number of neuronal antibodies are discovered. So the fact is you can have brain autoimmunity, and that's something that can be tested for and measured. Okay, and that's part of that test I was talking about, the Neural Zoomer, $720 test, measures this stuff. In the famous Framingham study, participants who reported drinking one or more artificially sweetened beverage daily compared to less than one a week had almost 3 times the risk of developing either stroke or dementia. So artificially sweetened beverages screw up your brain, okay? Like Diet Coke, Diet Pepsi, all of those things. They're worse than the ones with sugar in it. Okay, so don't drink any pop. Just avoid it. I mean, I would say in the last 5 years, I may have had 1 or 2, maybe. I remember Thelma and we went to a movie, and we had some tickets for some free stuff there. So I think she got a Sprite, and I may have had a couple of sips, and that was it. That's all I've had. Okay, because this stuff is so bad for you. People who undergo surgery with general anesthesia decline faster on measures of cognition and brain shrinkage in people who had not had surgery. Women decline much faster than men. So anesthesia is really hard on the brain. I had a patient, this is probably 6 years ago, 7 years ago. I don't know if you were working for me then or not, but he had some dementia, okay, but it wasn't severe, but it was apparent, okay, and he'd had both his knee replaced, and he had one of his knees replaced twice, and that wasn't working out. The second one was not working. He was in a lot of pain in his knee, so they did a third knee replacement on this guy, and he was not young. I mean, he's probably 80, 81. Third knee replacement. He came out of the surgery with full-on dementia, full-on Alzheimer's. Didn't know who he was, where he was, because it was the anesthesia is really hard on the brain. So if you can avoid surgery, do it, especially when you're older. So number 3. We need to optimize nutrients and the things that help the brain work. So there's strong evidence that magnesium supplementation, along with B vitamins, folic acid, can help Alzheimer's. So something like the product I have called Easy Mag, it's a whole food magnesium supplement, Cataplex B Core, really, really good whole food B supplement, which I take regularly. Can really help your brain maintain its function. Vitamin D is really, really important too. This is in JMA Neurology. Elderly people with a vitamin D deficiency experience cognitive decline rates 2 to 3 times faster than those with sufficient vitamin D levels. Now, what is sufficient vitamin D? There's a lot of controversy on that. So I would say your vitamin D should at least be in the 40s, okay? But 40 to 60, 40 to 70 at least. Vitamin D serves important roles in neurodevelopment and protection against the neurodegenerative process. And again, that's in Journal of Child Psychology and Psychiatry. So they're talking really about kids there. A recent study regarding cognitive decline in Alzheimer's in mice bred for rapid aging and decline revealed the following. The combination of vitamins and minerals, beta-carotene, bioflavonoids, cod liver oil, flaxseed, garlic, and green tea maintained brain cell numbers and mass, cognitive function, prevented deterioration of sight and smell. Okay, now that's in mice, okay, and this is mice bred for rapid aging. But all of this stuff is good for people. Like, one of the things that I tell people to do that are fixing their leaky gut is drink green tea every day. Green tea really helps the gut heal, okay? So I drink it regularly. Green tea, I have 1 to 2 cups every day, okay? And the rest of this is also very good. So because your brain is 60% fat, it requires good fat. So trans fats, man-made fats, damage your brain. So where do we get trans fats? Anybody know?
Cooking oil.
Yeah, all your cooking oil is going to be trans fat. Margarine, okay? All your processed food, Crisco, yeah, makes great pie crust, but it damages your brain, okay? So, yeah, darn, that's right. You know, and a lot of your processed foods have trans fats, fast foods. So intakes of fish or your omega-3 fatty acids have been consistently associated with the slowing of cognitive decline and decreased risk of Alzheimer's disease and dementia. That's in the Journal of the American Medical Association. That came out, it's a blue blood medical journal. It's 2016. So just taking omega-3 is really helpful. By the way, omega-3 fatty acids also help repair leaky gut. This study also emphasized diet, regular physical exercise, maintaining normal blood pressure, cognitive stimulation, as other factors that were effective. Coconut oil has had a positive effect on neurons affected by beta amyloid plaques. It's one of the reasons I put coconut oil in my coffee every day. Every day, get coconut oil. Here's a brain surgeon who wrote a book called The Brain Trust, who said that he recommends the following diet for brain healing. Foods that are high in cholesterol and animal fats, fish, seafood, meat, and eggs. He also recommends coconuts, almonds, and avocados, and the avoidance of sugar, empty carbs. Okay, here's another big deal. Chronic low-level infections can inflame the body. I did 4 of those brain tests within a period of 2 weeks. Every single one of those patients came up with an infection in the brain. Every one of them. All 4 of them. Okay? And it's all Epstein-Barr, cytomegalovirus, or strep A. It was one or a combination of those. So this is really common. Okay? Really common to have a low-grade infection that gets into your brain. Hormones, any of these, when they're way out of balance, can cause issues. And believe me, in this day and age, there's a lot of men walking around that are not making the testosterone they should be making. And a lot of that is because of their diets. Low-fat, high-sugar diets that your body can't make enough cholesterol to make these things. Other issues known to contribute to Alzheimer's, brain trauma. What happens when you get a concussion? What's one of the things that happens within 15 to 30 minutes? Anybody know? Leaky gut. Your gut starts leaking in 15 to 30 minutes. Also causes a disruption in your blood-brain barrier. So all the junk in your intestinal tract that shouldn't be in your bloodstream starts leaking into your blood, gets into your brain, okay? So why leaky gut has to be fixed, because I was talking to people in the lab, and they said anytime you see leaky gut, you have more than likely you have a disruption of the blood-brain barrier. And they said anytime we see a test that shows disruption in the blood-brain barrier, you probably have a leaky gut. So the two kind of go hand in hand. So how can we discover the causes of Alzheimer's? This is a really good test, the Vibrant America Lab Neural Zoomer, good place to start. That can at least let you know what's happening with your brain. So there's many issues that must be that can be tested. So if somebody came to me and they said, can you do at least one test to find out if I have Alzheimer's, if I might get Alzheimer's? I don't have a lot of money. I just want to do a test. I've got $100. Can you fix me up with a test? I would do probably insulin and A1C. Okay, high insulin, high A1C. Your chances of Alzheimer's are a lot higher. So I would look at blood sugar first. Okay, homocysteine is another one that is associated with brain atrophy. I do that test automatically. So you could start out with some basic things like insulin, blood sugar, homocysteine, inflammation, vitamin D. Okay, that would tell you that's basic stuff that can at least tell you, are the basic things in your body intact? Okay, so if you come out with low vitamin D, high blood sugar, we know we got to fix that before we do anything else. Okay, I don't care what the rest of your brain test says, you got to fix those. Okay, so then we could look at something like fatty acid testing. So if you have really low omega-3 fat, we know we need to get that up. Okay, and then we can test for some toxicity. Now, I want to talk a little bit about low-level laser because there's some really good research on that. Okay, we're gonna skip this. Okay, we're going to talk about exercise laser. Low-level laser has been a great, can really improve brain function in Alzheimer's. There's a whole bunch of different studies that show laser improves cerebral oxygenation, cerebral ATP, increases blood flow in elderly women. Laser may be a valuable tool in preventing or delaying age-related cognitive decline, can increase axonal transport and improve neuronal function. I have another slide with more research on there. I just wanted to show you that the laser that I use has really good research behind it. Let's go back to this one, exercise. We're going to do this one real quick. This is the Neurobiology Disease, June 2012. Physical exercise enhances learning and memory. It reinstates brain function. It counteracts age and Alzheimer-associated declines. It promotes dynamic changes that facilitate brain function. It's a protective factor against cognitive impairment. And it's inversely, the risk of Alzheimer's is inversely correlated to levels of daily exercise, even with walking as little as 1 mile a day. I'm a huge believer in exercise, and I think 1 mile a day would be the absolute minimum. That would be the very, very minimum baseline that you should be doing. But there's a lot of good research on that. Okay, here's a laser. So the last thing you do is you need to challenge your mind, okay? Learn to play an instrument, learn a new language, solve puzzles, read. I do a lot of this stuff just to get my mind, keep my mind, functioning and working better. So do you think that it's possible, after looking at the research, to really stave off Alzheimer's? Yes. Yeah. There's just a lot of things we can do, just basic things that we can do to help, and we're not helpless, So just getting your fatty acid balance right and getting your sugar down will really help a lot. So these are some things. Now, in next month, in January, and some of you already know this, we're doing our blood work special. Normally $425. We're doing it for $299. It includes all these tests that we were talking about, like, you know, insulin, homocysteine, inflammation, some of the things, vitamin D, some of the things that can really, really good baseline markers that you might, you know, want to do that test and just look at those and see what you've got. Okay. So, and if you know of people that are interested in Alzheimer's or that are concerned about that, you can share this information with them. If you want the slides, I know you will. I'll send them to you. You know, and you get a bunch of bonus slides at the end that I didn't use because I'm trying to keep this to half an hour. There's a lot of extra stuff in there that you can also look at. And if people want to come in and talk to me about the neural zoomer test, just have them call our office. I'd be happy to talk to them about it. The neural zoomer test for the brain is a simple, non-fasting blood test. You draw a tube of blood, and the amount of information you can get about on brain function is astounding. Okay, so you can think about that. And does anybody have any questions? Yes.
So, for someone who already has some memory or confusion issues, like they repeat themselves, etc., can some of that be reversed?
It's tough.
It'd have to be a major diet and life changing.
You have to do some testing. You'd have to really do some testing on that. Yeah. I'd want to do like a wheat zoomer test, look at leaky gut and wheat intolerance. Probably the neural zoomer plus, look at what's going on in the brain, and maybe test things like insulin, vitamin D, things like that. You'd really have to do some testing and plug the holes.
That's what I figured.
Yeah. And if you get them exercising, that's it. That's huge. Yeah. Get them exercising. Okay. Yeah.
So we have a whole generation of young people, our grandkids, that are growing up not exercising, and else they're involved in sports. They're on their phones and they're on their tablets and they're watching TV and none of this stuff is talked about.
I know.
They don't want you to know.
Remember when we were in gym class, when we were growing up?
Yeah.
They made us do push-ups.
Me too. Me too.
They made us do all kinds of things that were hard. At least I had to do it. I don't know about you guys, but I had to do it, you know, and then the big kids would throw us in the cold showers, you know, and you couldn't do anything about it because I was one of the scrawny little kids. So that was gym class in 8th and 9th grade. So, yeah, I mean, that's, people don't exercise. I think exercise is something that's caught as much as anything. And if they're not seeing somebody that they respect and like do it, then it's, you know, why should they?
Well, there's kind of a mindset that if they aren't good at it, then what's the point? You know, so if I can't be on a fancy team, you know, then and there's no, if there's recess, they're on the phone, you know, whatever, they're not doing things like we had to do, but it was good for you, you know.
Yeah, I mean, remember when we were growing up, we had recess, we played dodgeball, and somebody always get hit in the head with the ball, you know, and, you know, they get their bell rung, and that doesn't happen anymore. But that's always happened when we were growing up.
You learn how to dodge.
Play on the jungle gym.
Yeah, fall off, you know. Yeah. So anyway, yeah, I know it's too bad. I always tell people, look, anything that's worthwhile in life is going to be hard at first. Anything that's worthwhile, I don't care what it is, it's going to be hard at first. And at first could mean months, but it could mean years, you know. And that's something I don't think a lot of kids are learning right now.
So that if somebody has high cholesterol, when they're put on the statin, and they drop their cholesterol to 100 or below.
Awful. Bad. Okay. You know, you know, it's like trying to frame a house and you don't have enough lumber, you know, so you maybe have to make the room smaller or whatever, but there's so many things in our body that are made from cholesterol. I tell people, my cholesterol, last time I checked it, I think it was 223. So if I went to a medical doctor right now, he'd put me on a statin.
Oh, yeah.
Absolutely.
They want it below 200.
You know, I'm perfectly comfortable with it, 223.
I'm comfortable with mine at 240 or something.
Yeah, yeah, and women, as they get older, have higher cholesterol.
Right,
It
normally.
goes high automatically.
Yeah.
And don't worry about it. If your
I know.
HDL is high, your triglycerides are normal, don't worry about it.
Yeah.
What's bad is when your triglycerides are high. That's what you'd want to worry about. That's the lie detector. Like, are you eating sugar? Nah, I don't eat sugar. You know, triglycerides are 250. Yes, you are. You know.
Somewhere in there.
Yeah, yeah, you're hiding it somewhere.
What's sad is though you have to argue with your doctor.
What?
What's sad is that we have to argue with your doctor
Yeah.
when you
They're
don't want
not-
to take those things.
Yeah, they're not trained in prevention. They're only
Yeah.
trained in fix.
That's why I don't go to doctors.
Yeah.
I just don't go. I do my own blood work. You know, I know what to do. You know, so I just don't go to them. Yes, one more question.
thing. Almost 30 years ago, I had brain fog until like noon in the morning. I thought, what is happening, you know? And I talked to a friend, and she had me talk to a gal who owned a health food store out in eastern Colorado. And she said, get off wheat and sugars and dairy. And I did, and within 3 days, my brain was normal.
Isn't that
It was
interesting?
mostly the wheat
Yeah,
for me.
yeah.
I mean, I was coherent at 6 a.m. in the morning, and otherwise it took me like till noon to wake up. It was crazy. So
So-
it works.
Yeah. Oh, yeah.
Do you
It
think-
does.
They trace back the wheat problem as being what they do to grow the wheat now as opposed to what it used to be grown?
I think that's
I
a big
think
part of it. Hybridization.
Yeah.
You know, some of the chemicals they use on it. Like my mother, you know, like I said, who's 93. She used to bake when we were growing up. And here's what she told me. She showed me this the last time I was in California, which was in October. She said, wheat is not at all like it used to be when I was growing up. She said, I don't know what they've done to it, but it is not the same. She said, it just doesn't, it's just not the same. Which I thought was a pretty interesting observation.
You know Glenda.
Yeah, Linda.
Okay. She said when she went to Australia on a special trip, she could eat the bread down there and it didn't bother her because it was not this icky flour bread. You have to find the wheat that's the original, there's a name for that, the original, like it was 200 years ago.
Yeah, exactly.
But she said when they flew back, they came through Hawaii, so she had a piece of bread and she could tell right away it.
Well, that's really interesting. Yeah.
Yeah.
It's, you know, the food industrial complexes. I heard this expression I thought was great. I wish I would have thought about this. The brainwashing industrial complex.
Yeah, it is.
I thought that was a great expression. I thought that characterized our society so well.
It's so sad.
Yeah, it is.
Well.
Anyway, that's all I have. Thank you for coming tonight. Next week we're going to do nutrition and inflammation. We're just going to be talking about that particular issue. Good to see you, Chase.
Yeah, thanks for having me.
Yeah,
That's
you bet. Yeah,
really good to know, actually.
yeah. That's why.